Imagine for a moment that you could influence directly in one of the most complex systems of the human body, a system that until now has been almost unknown.
A system that controls your heart, your emotions, your breathing, tissue regeneration, and that is the key to relieving pain, reducing stress, and improving the quality of life of your patients.
We are living a history moment in medicine. The tools we have used so far have allowed us to help patients to get through pharmacology, biomechanics, surgery procedures, exercise, and lifestyle change. But what about the autonomic nervous system?
The system that regulates our organs, our response to stress, and the seems at first glance out of control until now.
You are not just in front of a webinar. You are looking at a door that leads to a new paradigm in medicine, a new way of thinking where science gives us the possibility to modulate the autonomic nervous system.
Today, we want to share with you something revolutionary. We are talking about a technology called NESA, which is capable to transform the way you treat your patients, not just by relieving symptoms, but by acting directly on the system that controls them.
Why settle the status quo when we know we can do more for our patients?
Innovation is inevitable in medicine, but the real breakthroughs happen when we decide to open ourselves to new possibilities. Today, you have the opportunity to be part of the change.
I am Fabiola Molina.
I am Maria Gonzalez.
Welcome to the webinar for the non-invasive NESA Neuromodulation. We are very pleased to have here today so many people around the world listen to us for talk about the autonomic nervous system and how important it is to understand and to know how to manage for treat our patient. Here is a very big possibility for get a step far away to get our treatments in a other level. Then we are going to talk about these systems and all the information that we have today for you. And in the last part, you are going to have a space for the questions. Then at the beginning, you can also write in the chat, and we are going to read you, of course, and all the questions that you will have. Well, we are going to talk about something that is quite similar, quite new. That is the bioelectricity of the body. We are saying in the introduction that this is a history moment, and it is because 100 years ago they start to understand the human body, the humanity start to understand the body in other level, and it starts with the biochemist of the body, all the chemist process that happens there. And the electrical part was starting to understand with the Nobel Prize of Andrew Hadley and Huxley, and they discovered the action potential of the nerves. And the action potential is going to explain us how the signals get into different part of the body. But it's only or the main thing that we are going to have the information that we are going to have with these actual potentials of the nerves are the sensitive and motor nervous system. Of course, the autonomic nervous system is here also, but in the last years there is some lines of research that teach us that this is not the only electrical system that is in the body. There are also the bioelectricity in the cells, in the hyperpolarity and the different direction of the electricity that orders the behavior of the cells, and this is going to influence directly in the homeostasis. all the basic homeostasis that the body have these signals that are like computering signal patterns, computering patterns. Then I recommend you to see some videos in internet or some TED chat of Michael Levin, because Michael Levin is, until these last years, having a very good research about how the basic part of the living things works. And of course we works in this way also. Then um, when we talk about bioelectricity, we talk about the basic function of the body. We talk about the autonomic nervous system. We all know that there is a sympathetic system, the parasympathetic system, the active and stress response for it in a way, and the calm and maintain response for other. And no one is more important than the other. It should to be in balance. It should to be both in a symphony for all the function in the body and the a correct behavior of the body. And if we have one of those more than the other, like today, the stress and the anxiety that we suffer, I think in the most part of the world, then it's going to be a disbalance and the problems are going to happen. But it's not only the sympathetic or parasympathetic system that we are talking about. We are talking about a pyramid system that have in the peak of this pyramid have the limbic system. Then the emotional part, the social part, is going to modulate all that happens in our body. And we know this because we all are healthcare professional, and we know that emotional part is one of the more determined things in the body that influence in the health of our patients. And this is because the disbalance of the autonomic nervous system. Not only the autonomic nervous system is going to modulate with all this part of hypothalamus and steam, is also the sleep time, because for have a good balance we have to sleep in a good way. Then we know that we have this REM phase and no REM phase, and no one, again, is more important than the other. There is one that is parasympathetic nervous system organized, like the non-REM mode that we said, that is deep sleep, that is going to regenerate the body during the night. And the sympathetic system is going to rule in the REM mode. And the REM mode, the brain is going to have a lot of activity, and it's going to be better that for the brain part, for all the lymphatic system during the day, and all these things that we already know. For the sleep quality is so important that allows for improve all the cardiovascular health or the mental health, the cognition, the memory consolidation during the night is so important that the teenagers sleep during the night for get this memory and this emotional part in a balance. And this is what happens with the teenage sometimes, that they change the way they sleep and they start to have problems. But I like to understand the physiological part first the physiological part, and then we can understand the pathologies. But this is not so easy, no. Then the immunity is going to get balance also during the sleep. The tissue regeneration, like you see in this video, this all these healthcare professionals, these doctors talking about how much this technology help the patients in the surgery, because the tissue generation appears during the night, and it's so important to have a good sleep. Also, the reproductive health and the hormone regulation is going to uh, improve when we have a good sleep during the night. Then, Maria, tell us.
And if we could influence the autonomic nervous system, nowadays we know that we can influence the autonomic nervous system if we talk in the language the autonomic nervous system understand. And this is chemical, and this is mechanical, and of course, electrical. Also, we know that we have different ways to neuromodulate the autonomous nervous system, maybe doing exercise, doing a diet, in a sunbathing, meditating with a good breathing, and of course now with NESA microcurrents. And how we know it? We know it because when we neuromodulate with NESA microcurrents, we improve the symptoms that depends on this system. And also we know that now we can improve this value that all we know, the heart rate variability, that is the gold standard to assess how the autonomous nervous system of people is. This is the incredible possibility that NESA training system and technology gives you. As you can see here, you can have the patient and with 24 electrodes that are placed in points of low impedance through anlets and gloves, and all the microcurrent is coming through your body through these electrodes. The microcurrent is trying to find the electrode that is going to be the maze that we call directional electrode. By this way, we are going to neuromodulate the autonomic nervous system in a global way because it's a global effect of the part of the nervous system. Sometimes symptoms are going to be in a local area, but the autonomous nervous system is a response system and involves all the body at the same time. Here we have the kind of microcurrents we are working with. And it's really important to know that the microcurrents are going to be really special for one concept, for the sequences, the variable sequences that NESA neuromodulation works with. Here we have the parameters, low current 0.1 until 0.9 milliamperes, ultra low frequency 1.14 until 14.28 hertz, and a voltage that we can choose that is going from 3 volts until 6 volts. But the most important of this is, for example, imagine in this sequence number 3, during 130 milliseconds, the electrodes that are placed in your hands, 2 and 5, are going to connect with number 23 and 26 that are going to be placed in your feet. And after 130 milliseconds, the sequence is going to change. So we are going to be everybody, as we are going to see now, changing the parameters and the sequences. With which kind of microcurrents? With a biphasic, two-phasic, symmetric current. We know this kind of currents, but what is going to make it different is the sequences with it works. Of course, we are going to have 9 configurable programs that I'm going to explain in a few minutes, but this is the clue, this is the key, how NESA is really special and is the unique one nowadays that allows us to neuromodulate by this way. You can see here the movement that how you can see how the lights are changing, are connecting the different electrodes during these sequences, and every time patient is receiving the treatment is having this modulating with the path of the sequence of the microcurrent. So how it works? If we have the patient, we know that we have a microcurrent, two phases, symmetrical, and the patient arrives, and depending in our resonant clinic, we are going to choose where we place the directional electrode. Remember, this is the electrode who is going to close the circuit, and if we want to produce a global effect, we are going to place it in the central part, 6, 7, or 6, 6 more or less. If we want to produce a general effect, or maybe at the beginning of the treatment, we are going to place it in central. If we want to produce the effect in a region, in an area, we are going to use the segmental or metameric placement of the directional electrode for an area. But if we want to focus the impulses in the directional electrode in a local area, in a specific area, we are going to place it in a focal way. These are the three kinds of location where we can place the directional electrode: central, segmental, and focal. And when we know it, we need to choose which programs are we going to use for this patient to try to treat their symptoms. We have 9 programs, and as a summary, we can have number one. Number one is going to be for hormesis, the minimum doses we need to produce benefits without side effects. Of course, we are going to use it at the beginning of the treatments, or sometimes when patients are really weak, or when we can find a low heart rate variabilities. We are going to choose number one, and we are going to leave it when we are improving and we are going on the treatment. We have program number 2, 3, and 4 that they are going to be the same program with the same parameters, but the difference is going to be through which the electrodes are going to come the microcurrent into your body. So we are going to have program number 2 for the ventral part. We are going to have program number 3 for the dorsal part, and number 4 for the lateral or sagittal part. So, as you can see, number 2, 3, and 4 are going to answer to the question, where do I want to produce my main effect? After that, I'm going to ask Nesa, and which effect I want to get? What are the effects I want to achieve with these microcurrents? Okay, so number 5 is going to be for fatigue, chronic fatigue, acute fatigue too, or to optimize the resources. Number 6 is going to be used for the pain, of course, nociceptive pain, neuropathic pain, or nociplastic pain. Number 7 is going to be used for the autonomous nervous system. As you can see, it's going to be our START program, because we always are going to consider the autonomous nervous system for different objectives, maybe for improve the quality of sleep, maybe to have influence in the vagus nerve, maybe to have influence in overactive bladder, maybe for anxiety sometimes if we combine it with number 8, for all the symptoms that we consider that depends on the autonomous nervous system, on the, of course, or more or less the parasympathetic, in this case, nervous system. Program 8 is going to be to the central nervous system. So imagine we are going to talk about fatigue, I'm sorry, about anxiety, or we are going to talk about stress, but also we are going to talk about concentration and focus because of the changes we know that we improve in the alpha waves. And at the end, number 9 is going for facial and trigeminal nerves, but not only for these nerves, I would say for all the cranial nerves, it is the area of the face and the cranial part, the head one. So, as a summary, you can see we have the NESA with the sequences, with the parameters in an algorithmic way, and depending on our clinical reasoning and the targets of the or the objectives we are going or we want to achieve, we are going to combine the location electrode, central, metameric or segmental or focal, and the 9 programs. And we are going to start with the patient, remember, in a medium long term, because if we are neuromodulating, we need to repeat the stimuli to try to produce changes in a neuromodulation, neuroplasticity, or neurogenesis. And of course, don't forget to reevaluate the patients with, we are going to talk about this too, with different questionnaires or the assess you are able to use to try to know how the evolution of the treatment is going and the patient is having a good results with this microcurrent.
This, what Maria talked about, is very important because this combination is the key for having the good results. And what about the results that we have with NESA? They are very interesting results because we can treat directly the quality of sleep of our patient. And I like very much to talk about this at first because this is one of the most effective treatment that we have allowed with this device, treating the quality of sleep of our patients. Then also we can get less anxiety of our patient. We can balance this autonomic nervous system with this combination that Maria talked about, that we should to make a clinical reasoning to get these results. And then we can treat, for example, with the electrode here in the wrist, and we can treat the anxiety of the patient. And there is so many symptoms that are directly influenced about with the stress. Is so directly relationship between the symptoms that the patient have, like digestive disease, like that bad regeneration of the tissue, or sleep problems, or the overactive bladder. There is very related with all this sympathetic and parasympathetic system. Then we are then, how I said, we can get allowed to recovery injuries. We have these diabetes people with the diabetes feet that the ulcers doesn't heal at all, and we can get a plus in our treatment, for example, getting this technology into our clinics and into the patients. And also the surgeries, we can get a better regeneration of the surgeries, and all these post-surgery pain that we can manage in clinics, we can also manage with the autonomic nervous system treatment. The overactive bladder is one of the most effective also. There is a lot of hospitals, public hospitals here in Spain, that are using it for their patients because they didn't have side effects and the results maintained in the time. And this is so interesting for the quality of life of the patients. Also, the concentration and attention of the patient, or types of patients like the autism, or the people who need to get concentrate for work, or for get some proofs like test exams, this teenage that should to concentrate, that can be very useful also. The sport performance, of course, if you sleep in a better way, you are going to improve your sportman performance, and the recovery that you have each day that you have this training, the hard training. And I like to say the last one, the chronic and neuropathic pain, because not maybe not the neuropathic pain is not so difficult to treat, but the chronic pain needs time. Maybe we need to do 10 sessions, 20 sessions for get in a better way a chronic pain, because it depends of the people. And if the pain is cortical state, is a central sensibilization, that will need to get to the patient maybe 2 months, 3 months, 4 months of treatments. Nowadays, I can talk that we are in the clinic where I work, in my clinic, we are making a research about fibromyalgia, because this is a chronic pain, it's a central sensibilization, and we are going to make in this clinical trial 30 sessions to the patients, because we know for the experience that we have for 5 years now, that with 30 sessions, the not maybe the 100%, but 90% of the patients are going to improve. And this is very important for these people. What are the contraindications? Well, every technology has their contraindications, and these contraindications are the same as all the electrotherapy contraindications. The first and more important is the pacemakers, the pregnancies. Of course, we are not going to to put the device to internal hemorrhages people, or thrombophlebitis, acute thrombophlebitis. We are not going to do this. And in the relative contraindication, we have more interesting disease like epilepsy or Korekis syndromes, because this is a relative contraindication, because we can put to the people, but with a specific treatment. or specific well, we should to take care about some things. The cancerous or neoplastic process, of course, also there is a relative contraindication, but there is some cases that we have and some clinical trial that are proving this. And then for precautions, we ask the patients not use the mobile, don't use electronic things, because this current Maria explained, they have so low parameters that can influence to the treatment. Then it's important to be relaxed, to be very, very comfortable, and the people in most of the case get sleep. No. Remove all the metals of the body, but there is no problem with no problem with prostheses or replacements in the body. The methods that we have for evaluate, it's this is the key of everything, because this is so amazing tool that we can have in the clinic. But if we didn't measure the things, it can be like a pleasure, a placebo. No, it's not a placebo. It's very, very superior as a placebo. But we should to prove it, and we are going to prove it measuring all the things. The first thing that we can measure, and it comes with the device, is with the heart rate variability. We have a device that take with the hands, or we can have a support in the wrist for measure the heart rate variability, and we can see change in these parameters when we treat the patient with this technology. Also, the cortisol, we can see change in cortisol. We can see change in the actigraphy, in the sleep time, how the REM phase can be longer, or the patient can sleep having less stops during the night. Is very interesting. And also, we have other methods like the questionnaires that they are not so objective like the others, but they are very, very validated also. And we have these scales, and you have all these things in the campus that NESA have for you, and you can get these scales and pass to the patients for know how they improve, and you can prove the patients that they are improving in a month, in a couple of weeks. And this is very, very important for this patient, this treatment, because we didn't feel anything when we are using it, and this is a problem. And because it's a problem, is a good thing and it's a bad thing. When the people didn't feel anything, for the chronic pain people, or the people have so much sensibilization, it's so nice that you can have a treatment that doesn't have side effects and improve, and you are not getting hard to the patient, you know. They need pain, more pain, and you can test it with the scales. And this is perfect for the clinical trials also. We can test with the clinical trial everything, because this is there is nice for a placebo.
Yes, of course, it's more, yes, it's better. So, one of the most important things you need to know is that when you start using NESA, you are not going to have access to the technology. You are also to have access to a knowledge. And we are working really hard to give enough knowledge to take the better results when you get the technology. We are going to have access and knowledge in different ways. Of course, we have an online university expert of the University of the Las Palmas, the Gran Canaria. Also, we are going to have a campus of guidelines to have access to try, to start, and to know how we use it with the patients. We are going to have different monographs, the urogynecology and the for the sleep drive. It's a specialization in the sleep. And I am sure we will have more specific monography in a few years. And it's important because it's not only to get the technology, it's the knowledge we are offering to you to help you and to increase all you need to know about not only NESA, of course, about autonomic nervous system. And we have different events we are organizing every year or twice per year. A Congress of Non-Invasive Neuromodulation, where we share a lot of information, actualized information about how it works, and you acquire the technology with the support, of course, that you always have when you acquire technology. At the end, it's important to highlight that you are going to have a personal support. It means lots of colleagues and partners that are working with NESA daily with their patients and they are having good results. They are going to share the knowledge, of course, and they are going to try to help you to introduce the NESA, the concept, the knowledge of the autonomic nervous system, how we use the technology in your practice. And this is really important because it's not only to get the technology and we are going to disappear. No, we are going to be closest to you and we are going to answer all the questions you are going to have in all your pathway through the NESA knowledge and work, of course. And it's important for us. Of course, also we are going to, if you have questions about research or the scientific part, you are going to be able to access to the electrophysiological laboratory of Las Palmas de Gran Canaria. It's important because you are not going to be alone. We want to help you and we want that you get the same results we are getting daily with our patients. This is the reason because we are now here. Look at 31 countries, more than 1,000 clinics, 22 hospitals, 15 universities collaboration. We have more than those you can see here, but right now, the fast growth makes it difficult to have this data updated. So we are with lots of hospitals, institutions, and universities with research and, of course, trying to improve the quality of life of the patient. That is our main goal doing this kind of work. Giving a special mention, because we are talking about the clinical part, is really important for us because patients are our main objective. Well, we didn't know that research is really important for us. And we must mention the strong work that the laboratory is doing, demonstrating scientifically the results we are obtaining daily in the clinic. Because we know that if we want to arrive around the world, we need to translate these results in graphs, statistics, and numbers. And this is the reason because we have here the number is increasing, Fabiola, 528 clinical trial sample. We are in more than 23 clinical trials running in different aspects. Look at this. If the targets are really variable, because the autonomic nervous system are in lots of symptoms and applications we have with our patients. This is the reason because of the variability of, you can see here, look at neuroscientific, multiple sclerosis, geriatrics, long COVID. This is the reason because the autonomous nervous system is the base where we need to build from this the concept of health of our patients. The evolution in the scientific part, the research, are in these dossiers, in these books that are being published every 4 or 6 months, are updated, and we are sharing the clinical trials that are ending, something what the ones that are in course, and we are really, really worried about update it twice or 3 times per year for you to have all the information and the evolution of the technology. So, as a summary of this webinar, It's really important, different concepts, but I would like to highlight some of them. First of all, the importance, as Fabiola explained, of the bioelectricity, and to consider it, to try to go deeper in this knowledge. And you can find a lot of information that we share with you. Of course, the importance of the autonomous nervous system and how we can influence on this, of course, with this technology that we train you to know how to use it and to get the best results, the application that are lots of Fabiola explained before, but we have more and more and more because we can see limits and the effects of the autonomous nervous system. And of course, sorry, I'm going to repeat it, the access you have to the technology, to the knowledge, and to the human part of the person, the people who are around here that are going to help you to introduce these concepts with your patient. So don't forget that we have a common objective in our life with this kind of technology, that is to improve the quality of life of patients, all the people we can treat in our clinics. So, finally, you have here it's going to be open a window where you are going to be able to ask your questions. Fabiola and me are going to be really pleased
Yeah,
to
there
answer
were
you.
some people writing some
Yeah,
questions, and I did answer some short question, not the big ones.
yeah.
And they are talking. Igor is asking if there is any scientific data available in the free internet access to the scientific world. And yes, of course, there is free internet access to some of them, and you can search in the PubMed, put in NESA Neuromodulation, and you are going to have some of them. But I recommend you to text us or sending us a mail into the people who invite you to this and to this webinar, and they are going to send you the dossier of evidence, and you are going to have every article there, and I think it's better than teaching for it. What about tremor? This is a good one. Yeah, we have the essential tremor that it's get worse when the people have anxiety and stress, and they are calm, they are get better. Of course, we are not healing the tremor. We are not going to heal this neurological disease, but we can improve a lot the quality of life of these patients, because these movement disorders can decrease the aggressivity aggressivity that they have, and we use it for this type of people.
Okay. I would like, okay, the pulse electromagnetic field therapy is a therapy that is really different.
Personality.
Yeah, it's really different to this. You know, the electrotherapy are going to have the different effect depend on the physical basis. And this is an electromagnetic one. Normally, if we place it in the head, we are going to go to the directly to the central nervous system with different effects, with more contraindication. It's really different. With NESA, we are going to neuromodulate the autonomous nervous system in a global way through a pathway that is a peripheral one, but the effect is going to be in the central nervous system. It's really, I would like to add one thing. You are able to combine NESA with other technologies, but at the same time, simultaneously, you not can use NESA with high frequencies. But if you consider, of course, you can try to neuromodulate the autonomic nervous system with NESA. And if you consider, you can use the pulse magnetic field therapy if you want to produce effects, for example, in cognitive path, focus, or some different symptoms that depends on the central nervous system. But it's not it's not the same, and it's different. It's a different way to neuromodulate it.
Yeah, it's a global way. Not
Yeah,
the magnetic is
not
more
central.
or is central or peripheral or in a part, but we are getting the electricity by hands and feet, and we close the circuit in the whole body. That is a systemic treatment. It's a global treatment. Shiva Parmam.
Okay.
How often we can treat patient? Can we treat them daily? Is there something like over treating? No, there is not over treating because the device have for 10 hours, for example, because it's a physiological current. It's physiological. Then the best way to treat a patient, it depends of the comorbidity or the goal that we have with the patient. Because if the patient have a acute pain or chronic pain that is very, very bad for the patient, we can do daily for have results quickly. And maybe if the patient have some psoriasis or dermatitis, that something that needs to have time for heal, maybe it's not necessary to treat so often. We can treat 3 times a week, 2 times a week, and we can have results with the time. And it depends of this.
Okay. Oh, this is for me.
This is, yeah.
Hi, I am a neurologist. I regard to overactive bladder. Is NESA dealing with muscarinic and beta 3 adrenergic receptor of the okay? Of course, we normally use NESA for the same objectives of the overactive bladder. We know that we are having lots of and good results, and we have different clinical trials in overactive bladder. And what we are going to do is to neuromodulate the balance between sympathetic and parasympathetic nervous system. Of course, we have patients at the beginning that they simultaneously are having the pharmacology, the muscarinic and beta-3 adrenergic, maybe, and at the same time they begin with NESA. And when normally doctors, when patient improves symptoms and they decrease the number of micturitions, they are leaving um, slowly and sometimes the pharmacology. So we are
But
considering that it's really important to consider that it would be the first line of the treatment, maybe, because it's a non-invasive neuromodulation with a really good results and no side effects. And we know that the adherence of the patients to this kind of treatments, sometimes the antimuscarinics or the beta-adrenergic one, they have not enough adherence to have good results with this technology because of the side effects sometimes, or sometimes because they don't get the results they would like to. So we think it's a good view, a good line to try to use because of the results we are getting daily in the clinic and the results we are getting, of course, in the research.
we don't I want to say about the other question that we don't have now basic science research measuring the muscarinic reservoirs in the wall of the bladder, but the results that we say that what that is Maria said, that the results that we have with the patients said that there are results with these receptors. Okay. It can be used with people with Tourette syndrome. Yeah, it's well, we are not going to have a big improve with these patients, but we can improve the quality of life of the patient, because if we modulate the autonomic nervous system, the patient sleep better, have less anxiety, they are going to adapt better to the disease, but not to improve the of course the syndrome, no, but improve the quality of sleep. And sometimes little things, little improvement in these patients, there is a lot for them and their families.
Yes. What kind of energy output does NESA use? It's like a microcurrent. Yes, of course, we talk about it. It's a microcurrent, but what makes it special is the sequences that NESA works with. Not only to be a microcurrent, because we have lots of different microcurrents, but we don't have other technology similar to NESA until now. So the difference, or what make it special, is not to be a microcurrent, a biphasical symmetric current, or sometimes a more cathodic monophasic cathode. It's the sequences that NESA works with. Do the patients feel it during treatment? Normally, patients don't feel anything because of the low parameters the technology uses. But sometimes they surprise us, and if they are really sensitive or they feel different things that nobody feels, there are a percentage of patients that sometimes feel something. There's some microcurrents, and they explain like an energy or movement, but normally patients don't feel. We have lots of different examples of people that feel, but normally patients don't feel the microcurrent because of the low parameters the NESA use.
It's curious because there is a type of patients that always feel it, and is there a stroke patient that have I'm hemiplegical. The hemiplegical patients feel the current during the first session, second, third session, the first ones, and they feel like tingles in this area of the hemiplegical part. And in a couple of sessions, it ends.
We can see here one question that is talking about the erectile dysfunction. Does NESA help the erectile dysfunction? Yes, of course. We can say it because we have results daily with patients who come to the clinic to improve it. And you need to consider and remember that the sexual intercourse depends on the balance of the parasympathetic and sympathetic nervous system. And the part of the excitability and the plateau we need to have the erection depends on the parasympathetic nervous system, and the orgasm and ejaculation depends on the sympathetic nervous system. So we need to have this system in balance to give the importance to parasympathetic or sympathetic nervous system when we need. When we have a low tone of parasympathetic nervous system, for example, if we are stressed, we are not going to be able to maintain the excitability phase and the plateau. So we are going to have or erectile dysfunction or um, how do you say, daily ejaculation. So it's important not only for this kind of disorders, sexual disorders. We have lots of different, like anorgasmia, dyspareunia, erectile dysfunction, premature ejaculation, that are going to improve with NESA if the main factor is the not balanced autonomous nervous system. So it's one of the applications we use in pelvic floor, or sometimes in the specialty of urology, or sometimes in other ones.
I want to answer to Helen that said that sports performance. I get asked how NESA can affect. Oh, thank you very much. This nice quip, nice team. For sports performance, I get asked how NESA can affect the heart rate variability, which I think will be answered in the training. Well, the best thing of all is that we can make clinical trial with this because the people doesn't feel anything, and we have a research with the football club Barcelona from basket from the Barcelona that measure the placebo group and the intervention group, and there are differences between groups, and this is the most important thing, that we can make placebo, and there are double and triple clinical trials, because blind, triple, double and triple blind, because we can blind everything. We can blind the therapist, the patient, of course, and the analyst also. And I want to answer also to Igor that say that everyone shares only the best results of the technology. Would you be able to share no result or unexpected situation with NESA device if you experienced them? I want to answer this, okay? Because this is true, and we know this from pharmacology, for example, that they only get the results. But in the 6 years that the University of Las Palmas de Gran Canaria had this in the laboratory of electrophysiology, every research was compared with placebo and is going to improve. And I want to say you one that didn't improve. There was a treatment research for fibromyalgia people, patients that have only 10 sessions and they have no results in this. It was no worse and it was no better. But nowadays we know that 10 sessions for fibromyalgia patient is so less that they are not going to improve. And nowadays we are making right now this research for I'm not making the research, they are making other people, but I lent my space for this. And um, there we want to prove that with 30 appointments the people is going to improve, but not with 10 sessions. Okay, I think if I can see something bad is that sometimes it's not a quickly a quickly treatment.
I would like to add one thing that we have a colleague in the team of the clinical department of NESA that is neurosurgeon, and he usually uses NESA before of the surgeries and normally after the surgeries, and of course in these cases where they need to receive a surgery for the spine cord, or NESA is not going to have the effect we would like to. So NESA is not a miracle, of course, not it isn't, and we have different things that we can't improve. But we know that the symptoms that we are talking about are susceptible to be improved with NESA microcurrents. But of course, NESA is not going to to go wood or for everything we would like to. Of course, we are trying to share the objectives or the targets that normally improve NESA with really high good results. I
This treatment current by insurance in Spain, they're starting. Right now it's starting because they are start to be in hospital, public hospitals, and in some of places they are starting to have this for free in the public insurance for the people. Um,
I would like to answer this. It's important because it's basic. It's possible to create any harm to the patient while using NESA device? No, it's not possible because NESA has not side effects. It's a microcurrent, but not only for being NESA, it's because the microcurrents,
Microcurrents.
the effect that we have with the microcurrents, not only for NESA. It's not, it's really safety, and it's not a problem to try to to test it with your patients if they are not inside the group of contraindication, of course.
And do you have any experience with persistent genital arousal disorder? My initial thought is to use P1, P7, P8 for the first few sessions and then combine with P2, P6, any through. It's very nice. I like to have clinical reasoning here because this is a very basic training. This is a very basic webinar. This the basic for training is until 4 hours, 6 hours, and we are trying to get all the information in this quite quick time. And I think, Michael, this is a very reasoning for start. And in this type of patients, maybe Maria can explain better for the genital arousal disorder.
Yes, in this is the reason we have lots of different good results in the pelvic floor technological part, and it's really hard for me now to explain in 1 minute where we can influence with NESA. But if we consider the physiopathology of the symptoms the patient has, we know that all the viscera and this kind of function depends on the autonomic nervous system. And this is the reason because we are trying to know in which symptoms we are going to have the best results. But to give a general information now, I think it's not be a good idea because we are going to lose the, the real effect when we work with the area of the pelvic floor in the different symptoms. I don't know, Fabiola, if I have explained it. Good.
Yeah.
But it's really difficult to explain now because we need to emphasize in the knowledge, the basic knowledge, and the autonomous nervous system in
Well,
this area.
these they are complex patients, and what I can see is that they need a lot of sessions. They are going to need a high frequency
Yes,
and a
of
lot of
course.
sessions. But the thing is that they don't have any other um, yeah, other treatments. There are no better treatments, because it will be better treatments, we will recommend it. But for nowadays, for me in my praxis, is the better I see for these chronic pains. And Sane Anna Lituanice, they say, what about people with oncology? This is a good question. Is a relative contraindication, because nowadays there is starting being some evidence of the microcurrents and oncology patients. There is a clinical trial in Mallorca starting for when they start a couple of weeks ago, and they are doing the research with survivals of cancer survivals, post oncology pain. And we know that this type of pain is very nice because it's a neuropathic pain in almost of the cases. And and there is other people that is treating, but it depends of the place, because if the oncologist uh, said that it can be available to this, but it can be available, but it's not an absolute contraindication. It's relative contraindicated, and it depends of the opinion of the specialist, because this is so low parameters. This is a microcurrent that it doesn't get the action potential. It doesn't make. It's only to the cell's behavior, and we have some nice results, but it depends of the we have no clinical trial with active cancer, and it depends of the specialist.
So I think, Fabiola, we're going to answer the last one because we
Yeah,
need to finish the webinar. Of course, we are going to give our contact, and if there are any question that we haven't answered, please write it by email. That we are going to answer all the questions, of course, in 1 or 2 days. But I would like to finish with this of April. She's asking about if we program accordingly to the condition of the patient, for example, fibromyalgia, or if NESA produce the treatments according to symptoms. Of course, it's going to be according to symptoms because we are not going to treat the condition or the disease. If we have two patients with fibromyalgia, one of them is going to have bad quality of sleep or maybe chronic pain, and the other one maybe rigidity or chronic fatigue. And
yeah.
we are going to use the directional electrode and the night programs depending on the objectives we want to achieve, but not depending on the condition of fibromyalgia. Okay?
This is the ideal part of treating the patient, personalize the treatment. But for example, in the research that is not clinical part, in the research part, we use, of course, always the same programmation, the same configuration of the device for everyone, because you should to compare. Okay, then you are going to have our emails. You can text us and ask more questions. Then we are going to end this webinar, and we continue with the webinar for ending it. And as as Albert Einstein said, insanity is doing the same thing over and over again and expecting different results. If we continue to treat our patient in the same way without exploring new alternatives, we are limiting their well being.
Today, we have seen that the future of medicine is here, and it's not about following the same old path. It's about having the courage to embrace the new, the transformative. NESA is a technology that represents that evolution.
You have it in your hands to be a pioneer in this change,
To bring a revolutionary solution to your patients.
to improve their quality of life, intervening in a way that has never been possible before.
The autonomic nervous system is no longer unreachable. We can now influence it, modulating its behavior, and that changes the rules of the game.
Thank you very much.
Thank you.